I don't have any PowerPoints. No nice pictures. I don't have a script. When I was contacted to come here, I was asked to facilitate a discussion about social development and health policy development. And I thought, well, that's kind of interesting. It's like a Venn diagram, except there's almost no point of intersection. So here we are. We have about 90 minutes. And what I thought I would do is just give you a little bit of background on who I am and what motivates me to be here to speak to you today. And then maybe we could have a discussion about these questions of social development and health policy development. So I'm a professor in Faculty of Health Sciences at Simon Fraser University. I've been at SFU for about 22 years, and I'll be there for another 2 weeks before I leave to take up a position at the University of Victoria. About 10 years ago, I got involved in developing the Faculty of Health Sciences. I've been involved in health research. My background is geography and epidemiology. And I've always been interested in how we understand the everyday realities of our lives. You know, the ins and outs, the mundane 24/7, 365 and a quarter that we live, and how that relates to health outcomes. And how we live in a culture in which mostly health outcomes are associated with moments of high drama, 911, emergency crisis, and so forth. And I guess one of the things that actually I believe to be fundamentally true is that health isn't really about that at all. It's about the ins and outs of our everyday lives. And I want to talk a little bit about that, and then we can just have a discussion about some of these things. So let me just explain, I guess, how I came to be doing what I do. So I was fortunate in the early 1980s to run into a fellow named Fraser Mustard, who sounds like a person out of, Clue, exactly, in the library with a wrench, And I was in his very first graduate class called Population Health. And so I was a master's student. I just finished doing an undergraduate degree in geography. I went off to study epidemiology because I was interested in health research. And then ended up in a classroom with him and a guy named Mike Rackless and a fellow named Clyde Hertzman. And it was quite an experience. And through the course of our discussions, at that time, of course, it's 1982, there wasn't a lot of evidence around. There were the Black Report had just been suppressed, right? We had copies, photocopies of it prior to it being released as a penguin, and looking at the experience in the UK after 40 years or 35 years of a public health insurance scheme, and seeing that, in fact, differences between social classes were widening, not narrowing, and that this was despite health care that was free at the point of service. What was going on? Now, clearly, one of the things that was true is that everybody was on an escalator going up. Okay? Health was improving for everybody. It's just that if you were in the upper occupational classes or in the higher social classes, your escalator kind of went like this. And if you were in lower social classes, your escalator kind of went like that. And so over time, differences started to widen. So that was one thing that I guess really profoundly influenced how I tried to understand the world. A second thing was that as we sort of progress through this, so, we get to, of course, 1974, we've got the Lalonde report that says health does not equal health care. 1986, we have the EP report saying we've got to do something about health inequities. We give way to the Ottawa Charter. We have all kinds of fantastic analysis and great rhetoric. But, we still haven't cracked that nut. When you think about the ways in which we organize social policy, we have a Ministry of Health in which we conflate the idea of health and healthcare. And we have a political system, I think, that is almost paralytic when it comes to trying to penetrate that. Ministers of health don't want to talk about housing, they don't want to talk about human development, they don't want to talk about work, they don't want to talk about participation in daily life, because they're under siege. They always have too little money to go around to meet all the needs that are out there for all the kinds of services that people want, demand, expect, or whatever, whether it's the people themselves or the people acting on their behalf as their agents, their physicians, or whatever, wanting to recruit these services into their lives in the service of repairing them, of kind of salvaging them, or monitoring their well-being. So, in developing the Faculty of Health Sciences, we really wanted to start from this position that says, wait a minute, we get these social gradients in health outcomes. Anybody not know what I mean when I say social gradient in health outcomes? This is really refreshing. Because we've been talking about this for a long time, but we still don't have a public discourse about it. So we were interested in trying to understand how we understand our biological beings at the same time as we understand us as social beings. Because it's the interplay between those two things that we think somehow is bound up in producing these gradients. And what the evidence shows us from around the world is that, you can find gradients just about anywhere you look for them. But what matters so much is the slope of the line. And that seems to be related completely to how well we are able to care for one another, how well we can participate in everyday life, how well our lives have meaning, that we feel we count, that we feel we can do the things that we aspire to, that, somehow, as a person, we matter. As a person, we can participate. So when we think about, in terms of, I said that we're in a bit of a soup, what I really mean is that, well, first of all, we have this crazy federation. I mean, this is right out of Star Wars. You've got population densities, 10 million, that dominate the country. You've got small islands that are also part of the country, and everybody trying to participate and cooperate with very different kinds of playing fields, different kinds of cultural practices, histories, and regimes when they joined the Federation and when sort of settlement came to different parts of this fair land. And of course, from the get-go, a jurisdictional divide that meant that it wasn't the Federation's job to worry about these things, it was provinces' jobs to worry about these things. So you've got federal governments doing things like the Lalonde report or the Yep report or other reports that come out through CAIHI and so forth saying this is the state of affairs in our country with no jurisdictional responsibility to address them directly. We had a long-promised child policy focus that the Liberal government tried to bring out in the very last gasps of its last days that translated into $100 a month for kids under age 6. We don't have a coherent housing policy. We decimated that in the 1980s. We don't have, we have all kinds of systems that seem to be in trouble. And yet we continue 35 years after the Lalonde report to still equate health with health care. One of the studies that we did recently was to look at Canadian newspapers. We did two papers. One was called Telling Stories, which analyzed 4,500 stories in newspapers across the country in French and English, looking for a phrase or its equivalent, social gradients. We found almost none. Right? We tend not to talk about this. Our discourses, such as they are represented in newspapers, 2/3 of all stories are about the health care system. There are lots of stories that we could tell that are about health that we never actually make the connection to. Early child development typically is devoid of any discussion about health. The organization of our work typically is devoid of any discussion about its impact upon health. Access to education, I mean, really think about all the different domains of our daily lives. They all influence our health status, but we as a culture seem to lack singularly the ability to talk about this in a way that is coherent, in a way that is part of our everyday practices. We hive it off, or that's the healthcare system. We hive it off, or that's the education system. We're really good at producing the rhetoric. Everybody knows the Ottawa Charter. We're really good at that. We haven't been very successful as a society in calling a spade and in correcting our language to talk about this. So that when we talk about human development, we're talking about health outcomes. When we talk about the nature and organization of our work, we're talking about health outcomes. We seem to want to leave that to discussions of that high moments of trauma and all of the gee whiz that goes along with it. And that, I find, I don't want to sound like an Eeyore, but that's a little bit dismaying after all these years, I mentioned that we had a paper called Telling Stories. Another one was called Spreading the News, where we actually talked to 12 health beat reporters across the country. And that doesn't sound like very many, but for a health beat, that's almost a census. Everybody who's involved in writing about this for the major dailies. And we asked them, how do you understand this thing called population health? And half of them saw health as fundamentally about individual behavior. People making bad choices around diet, around exercise, and so forth. Half of them. Individualized kinds of understandings of what shapes health. A couple of them really get it. The Andre Picards of the world, sadly there are only one that I'm aware of, understands it. He's worked at it, trained, and so forth. And then, there's a smattering. There are some who kind of get it, but actually most don't. When we asked them about what their sources of information are, everybody talked about New England Journal of Medicine, The Lancet, Science, Nature, JAMA. So they're looking at sources that see always a relationship between the biology end and health outcomes, and really don't engage with the interplay between our biology and our social beings. So really, one person mentioned that they would seek a source like the BMJ. Right? The BMJ carries lots of stories about social gradients in health and so forth, but they tend not to focus on that. So you can see how, in a sense, this problem is perpetuated. People look for particular kinds of sources to report on their stories. And I think as a society, we are really into salvation. It's kind of the new God. Save us with technology.
Excuse me, what was the name of that study of the health reporters?
Yeah, it's called Spreading the News.
Spreading the News.
Yeah, and just so that you know, I'm happy to send you copies. My email address is @sfU.ca, right? Michael, HAYES, that's all one word, @sfU.ca. If you send me an email, I'll happily forward a copy of both those papers to you.
For the next 2 weeks.
Pardon me?
For the next 2 weeks.
Well, I'll have that email address for a while. So just a couple other things, I guess, just in reflecting on this. Recently, we've done some work on looking at childhood obesity, the so-called epidemic of obesity. And what we found is, again, the gradients. We use what's called the National Longitudinal Study of Children and Youth, NLSCY. So that's a panel study. It follows the same people over time. So we had about 10 years worth of information. I should say we had 4 information points that spanned about 10 years of a person's life. And what we did was then now these are self-reported body weight measures, and that's problematic, but that's the best data we have. And when we put kids into neighborhood groups according to family income and put them, like we have information about where they live and so forth, and sort of clustered all of those places around according to dimensions of income and housing status and so forth, we see a gradient in body weights. right? And so, of course, the kids who come from the wealthiest families have the lightest body weights, and kids who come from the poorest family have the heaviest body weights, and it's a gradient, a stepwise function. And so people say, well, it's because bad people behaving badly or poorly or whatever. You think about, there's been work looking at the location of fast food joints that offer energy-dense but poor nutritious foods and so forth, and they're not randomly distributed. You look at access to fresh fruits and vegetables and so forth. If you don't have a car to go in a big, box shops, then it's difficult to get really good fresh food at a reasonable cost. But the most important thing that we found from that work was this. We found that there are two observations. Number one, when we analyzed information about kids' participation in sports, if you looked at organized sports, it follows exactly that same gradient. The kids who come from the wealthiest families have the most participation in organized sports, and it follows the gradient down to the poorest kids. Interestingly, when we looked at unorganized sports, defined as doesn't have a coach or a manager, right? So probably no fees to join, probably no regular thing. It's like going out and playing ball, hockey, or whatever. No difference. When we looked at a question that said, asked people to agree with the statement, this neighborhood has safe places for kids to play, we saw the gradient, tracking exactly body weights. Right? And if you think about that, people talk about how, it's just because kids are sitting in front of computers or in screens and not being active and so forth. And to a certain degree, I think that's true. But look, we're all so afraid of each other these days. We've got real rates of interpersonal violence dropping while perceived rates are going through the roof. We need to get tougher still on crime and so forth. I think if I were a parent concerned about my kid's safety, maybe I don't have a car. And let's face it, there's been a huge demographic shift from the time I was a kid to the time of kids today. When I was a kid, there were 10 kids for every one kid that, has a friend who's 10 today. So, we were just, we were thick with kids on our block. You could just go out and play with anybody all the time. One rule, come home when the streetlights come on. And everybody was up. So now we've got, actually fewer kids, so that's harder to do, and people driving kids, and so you need the time and the vehicle and the resources to be able to do that. Ultimately, it seems to me that it is probably what we might call rational behavior to say to your child, play with your computer. If you're living in a world where you feel frightened of one another, where you don't have the resources to take your kid from point A to point B to play with playmates and so forth. I think, so ultimately, I guess, what am I trying to say? I guess I'm trying to say that the work that we've done sort of shows in spades, as the work in this field has done for several years now, that our social lives matter, that it's about that social integration, that all of that stuff we should be thinking about as part and parcel of health development. And everybody knows Clyde's work, and so you know what that's about. Everybody knows the work of Mike Ratcliffe, and so you know what that's about. All right? We seem still not to be able to carry on conversations in polite company in which we put those things together and talk about the ways in which we access work, the ways in which we access locations in neighborhoods or in whatever spaces, urban, rural, remote, that's part and parcel of a story about health at the same time.
Dr. Hayes?
Yeah.
What was the second author or the second my character that you talked about? You talked about Dr. Chris Smith.
Yes.
The other...
Mike Ratcliffe. Mike Ratcliffe has written a couple of books. One's called Second Opinion. And it's really trying to understand the health care system and looking to make the health care system more effective and more efficient. And he's been a long-time critic of the way in which medicine is organized, although he's not a critic of organized medicine. He's a critic of its relative disorganization and argues that if we could organize it better, it would be more efficient, more people would be reached, and we would all be somewhat better off as a consequence.
I'm curious whether you're seeing any change in terms of graduate student programs now. I work for the Nurses Union, and social determinants of health is an issue that's close to nurses' hearts.
Sure.
But we're about to do a round of educationals in January looking at social determinants of health. And I'm seeing students as they graduate have quite a broad scope and a broad understanding of social issues and determinants. Older nurses may not have the same thing. So I'm wondering whether you have done any or know of any research that looks at how perspectives have changed.
Sure.
So you interviewed researchers
Sure.
or writers,
Yeah.
and they're not talking about social determinants of health. So are there other groups or other professional groups?
Well, it's a good question. I mean, I think if we think about the growth of, so I mentioned our own program, which is, Faculty of Health Sciences with a focus on public and population health. There are so many new programs in public and population health now, and I suppose also in global health, in indigenous persons' health, and so forth, all of which kind of follow, I think, the same basic roots. So I'm not aware of any formal sort of analysis that has monitored this over time, but anecdotally, when we built our program, we weren't sure how many people would come. We were told that we had to attract 1,000 students in 5 years' time. Well, we're up to about over 1,100 now. And that's because bright young people are interested in these things. I chaired our graduate program, and we've just finished an intake for our MPH program, our Masters of Public Health. And I have to tell you, we had 300 applications, and the people who've applied, I'm sure they don't use the floor to walk. They just kind of hover through space because they're amazing. They've been to Africa. They have 4+ GPAs. They volunteer in their local community. They speak 4 languages, and they're interested in making a difference. It is gobsmacking.
Why is that?
Well, I think, I think for all the doom and gloom that I started off by saying, I think actually there are lots of young people in the world, lots of people in the world who actually want the world to be, more just, more equitable, and who have a new consciousness about things. I think in particular, you look at environmentalism and the way in which it gets us out of historical boundaries. It's not just about bounded spaces anymore, and it's not about bounded time frames either. Young people are people who understand that, hey, the world's going to outlast them, and that people have been circulating around the globe for a long time. And maybe there's really only one answer to the question, where you're from, and maybe that's Pangea. I think that's kind of what's happening. And so in some senses, that's exceptionally hopeful, I think. Some of you may be familiar with the work of David Holchansky, who's now at the U of T, who was here for several years. He has this shocking analysis of using the General Household Survey, actual monitoring complete wealth that people have, going back the last 50 years. In the 1960s, if you surveyed people according to whether they owned or they rented, there was almost no difference by income. You were as likely to rent as you were to own. By 1990, it had completely changed. Now, land ownership is absolutely connected to total wealth. And what has happened is, in that interval between about 1960 to about 2002, the difference in absolute wealth between the wealthiest and the poorest 10% was about 29 times. All right? In other words, the wealthiest had about 29 times more wealth. By the 2000s, it was about 145 times different. And there are 2 reasons for that. One, of course, is land price inflation. Right? I'm still I'm still struggling with the idea that a $100,000 home doesn't come with a circular driveway and kitchen staff. Because my parents were buying a house for $10,000 when I was growing up, and that's what I remember. We live in a city here where, what's the average price of a home now? All right, and then you think about changes in wages over time. So the reason why that divide has happened is partly because there's been so much inflation in the land market that give people real wealth, and partly it's wages haven't continued to rise. In fact, they have tempered off or fallen, right? So when I was going to university, I could get a job. I'm from Ontario, and I could get a job in the steel mills of Hamilton, and I could make $32 an hour. Today, and that's $32 an hour in 1970s dollars. So, how much would that be in today's dollars? And my son gets a job and he makes $15 an hour. And I think that those kinds of things have happened big time. So your point, I think, is absolutely dead on. And, in a way, people don't like to think about this, but Canada is very much like Brazil. A country of the landed and the landless is what we're really becoming. And it's crazy because it's such a big space.
Have you noted any changes in economic and social policies that have been reflective of the changes that we're seeing that are trying to address these issues? Like you said, there's these reports that have been coming out for many, many years now.
Sure.
We've had changes in governments. There's history here that's already been happening.
Yeah.
Are we seeing different development, different policies that are actually impacting our systems positively now? Or are there ways that we can actually influence that change in the positions that we're in?
It's a very good question. I think, so again, I apologize for sounding like an Eeyore because I'm really not by nature. And there have been some, I think, important things. I think using the tax system as has been happening to try to increase people's incomes is a trend that we've seen a little bit of. But, we can hold our experience of seniors in this country, where we decided that it was not just to have seniors living in poverty. And if you look at what happened to seniors living in poverty, we haven't eliminated it, but boy, have we ever done a pretty good job at taking, through, guaranteed incomes and through pension plans and so forth. We've actually done a pretty good job. But if you look at kids living in poverty, it's an opposite kind of thing. In fact, those lines crossed a long time ago. And so it's clearly possible for us to create programs that address the problem. It's just not politically popular right now to do that. We don't really have a discourse about class. We have a discourse about behavior, we have, the assumption is everybody starts off on equal footing, and then some people unfortunately make bad choices. We don't have politicians talking about conditioned choice. We don't have people saying, well, okay, how come we've got intergenerational poverty? Or an analysis that says, hey, who can take advantage of higher education? Right? Look at the distribution of people who are going to universities. It tracks completely the distribution of wealth. Right? And so I think Canadians believe somehow. We always compare ourselves to the United States. We're a kinder, gentler nation, and we have gun control, and we have health care. Apart from that, we're just like them.
French banking.
And so we're happy to compare ourselves to, in a sense, the worst, in a certain sense. In terms of divides, in terms of, if we could compare ourselves to Northern European countries. We could compare ourselves to Australia. We could compare ourselves to lots of other places. And it would create a very different kind of pattern. But Canadians don't have that. We have this sense that it's all okay. Everybody's good and so forth, We live in a loving country and everybody is good. Don't we? Am I all wrong about that? Or And there's a kind of a leadership vacuum, it seems to me, there. You know, who are our great statespersons now? You know, I mean, again, partly that's because there's media everywhere and it's impossible to have kind of an overarching narrative anymore. The web kind of put that to rest a long time ago. We live in these small parallel universes, you know. But, you know, as a young person thinking about people like Lester B. Pearson or Trudeau, where there was a statesmanship in a sense, there was a vision, and it was not about leading by following the polls, it was about following convictions and standing for something. And that's kind of where the battleground was in politics. And I think now everybody's crammed into the center trying to occupy that, you know, shades of difference between them. And everybody's doing it by polling. Everybody's doing it by polling. I don't know if any of you have ever been to the Canadian Public Health Association meetings or groups like that. I can tell you when David Butler Jones was appointed Chief Public Health Physician of Canada, that year the CPHA meeting attracted over 1,200 people. It was absolute euphoria. This group usually attracts about 400. Everybody was intoxicated with the idea that our day has finally come. Mm-hmm. You know, we now have a spokesperson. We can talk about population health openly and, you know, in polite company. And then think about what's happened. David Butler Jones was on the newspaper front page almost every day. We had a Minister of State, Carolyn Bennett, for public health. Right? We had a regime change. David Butler Jones, the only time he's been in the newspaper lately is when he's been looking foolish around immunization strategies. Mm-hmm. Quite honestly and bluntly. And that is no disrespect to David. He is, to my mind, an absolute gem who works so hard on our behalf. But it's just the shifting political landscape that sort of leads to this. You know, I find it a little bit dumbfounding. You know, the corrosive effects of poverty have been known forever. And yet we're still asked to show me the evidence. You know what I mean? Mm-hmm. You know, it's just a little bit dismaying.
It has to affect the person. Like because we're so egocentric, unless we market it in a way that, oh my goodness, if I don't do that for that person, it's going to impact me.
Yeah. So I think that there are some real bright spots here, and I don't want this conversation to end or just focus on the negative. There's lots of negative to go around. So one of the things that I was going to suggest, and it really follows this in a certain way. I've recently started teaching courses in injury and disability. And when I talk about, so I have about 130 students in my class. These are 22-year-olds. Think about it. Injury and disability. We talk about people who are invincible, who are completely able-bodied. What the heck have you got to say to me? Well, it was one of the most inspirational encounters I've ever had with young people because they actually get it big time. I asked them a question, what does it mean to be a human being? What does it mean to be a human being? You know? If we're all temporarily able-bodied, maybe we want to build a world where we can all be. Maybe what we really want to do is to take what we think is normal, that has a distribution like this, and make normal look like this. You know? That everything that we do should be about making normal look like this, because that's the reality of who we are. And they get it big time, you know. I mean, it was really so moving, and I think that's the kind of world that they want to be in too. And I think, you know, the degree to which we can make normal look like this, we're all going to be so much better off. And so that was one of the things for me that was a real important learning. All right, because I don't imagine myself as a disability or injury researcher. I've never really published in the area. I've got a son who's 16 who's severely compromised, and so I have a lot of personal experience with it. And it was just touching them around some of these things and realizing, you know, that, gee, this could be you. And don't we all want to be in a world where we can participate? Don't we all want to be a part of something that's exciting, something that's meaningful? Then why are we going to allow structures to do this? to make this normal and everything else not be normal. And so, at the end of the class, I had these students, thanks, But it is just an interesting, I found anyway, an interesting idea that if we can make this the normal, then we'll all be so much better off.
Yeah, I understand.
We tend to have this zero-sum kind of mentality. If you're getting, I'm losing, that sort of thing. And, how do you create a conversation that says, wait a minute, why do we have to make that the zero-sum? And again, I come back to the disability thing, because if we build environments where everybody can access them, then that's not for one person, it's for everybody, And who loses there? Well, if there are no more comments, thank you, and enjoy the rest of the conference.